Preventing injury. Working in the home carries some different risks than working in an institution. Some potential hazards that are faced by home health aides are ergonomic issues, physical conditions, potential violence from patients or others, exposure to communicable diseases, hazardous chemicals, exposure to tobacco smoke, pets, oxygen equipment or tanks. The job of a home health aide is often a physical one. It's important to stay fit and healthy and to take measures to prevent musculoskeletal injury by following proper body mechanics. Body mechanics will be covered in more detail in a later module. Back injuries from lifting and moving patients is one of the most common injuries to a home health aides. If you want to avoid a back injury, always ask for help with heavy or hard to transfer patients. Practice good body mechanics. Take advantage of transfer assistive devices. Don't rush. Keep a reasonable pace. Try to break up heavier tasks with lighter tasks to rest your body. Don't take injury-inducing shortcuts. Many injuries to home health aides occur as a result of stepping on an unstable floor or stepping on a sharp object. Always check that the floor is stable before taking a step. If possible, keep shoes on when visiting a client's home. And if your client's culture demands that shoes are removed at the door, bring a pair of shoes that are only worn in the house. Be aware of slippery floors. As a home health aide, you will likely come across patients or family who are angry or hostile. Try to stay calm. Stand facing the aggressive person with your feet slightly apart and hands at your side with your palms up. Keep your voice low and keep your rate slow. Don't argue with the aggressor. Be polite, calm, and positive. Identify the issues leading up to the escalation and let the person know they are being listened to. Reassure them that their specific concern will be addressed as soon as it's feasible to do so. Help the person with the agency's complaint procedure. Remind your patient of behavior expectations. If possible, phone the office to alert them of a problem. Use a prearranged code if possible. If you suspect the person is going to lose control, leave the house. If the person brandishes a weapon, leave immediately and phone police. Don't worry about leaving your possessions behind you. Your life is more important than your belongings. You may often be exposed to various communicable diseases in your job as a home health aide. Infection prevention and control will be covered in more depth in a later module on infection prevention and control. Always follow standard precautions. Wash your hands and wear gloves. Use appropriate PPE. Remember, even if you're not worried about being sick yourself, you have contact with vulnerable people who could become seriously ill from what you might consider to be a minor illness. Notify your supervisor if you're pregnant. Certain infections can be more dangerous to the pregnant worker and unborn child. You may come across hazardous chemicals in the home. Be aware of hazardous chemicals in the house and conduct a formal, documented inventory of chemicals and other hazards. Ensure hazardous chemicals are labeled properly. Be aware of any hazardous medications that the patient might take, such as anti-neoplastic medications. Even the most friendly pets can turn on you if they think you are hurting their owner. Some people are more comfortable than others with cats or dogs, or some people may have allergies. The best rule of thumb is to ask that animals be kept away during your visit. If all caregivers consistently ask, then it will soon become an expectation for the patient. It won't be about one nurse liking the dog while the other does not. Do not offer an outstretched palm or look at a dog or cat in the eyes. Do not approach a dog or cat that has its hair raised or bares its teeth. Try to keep a distance of at least 10 feet from a dog or cat. If you're required to clean up after pets, make sure to wash your hands thoroughly with soap and water. If you're pregnant, You must not clean up cat litter or cat feces due to the risk of toxoplasmosis, an infection that is asymptomatic in the woman but fatal to the fetus. Keep a flea spray bottle in your car and spray your lower legs and feet if you are concerned you've been exposed to fleas. Sometimes injuries will occur with pets in the home. If you're bitten by a dog or cat, wash the bite thoroughly with soap and water. Seek treatment if there's a laceration or a puncture. Rabies prophylaxis may be required if the animal has not had its rabies shots. If you're scratched or bitten by a cat scratches and bites can result in a condition called hemorrhagic septicemia or cat scratch fever. Report to the hospital right away if you develop a fever after a scratch or bite. All animal bites must be reported to the CDC. Reassure the patient that they will not be in any trouble, nor will the pet be in any trouble, but that the report is simply for the infection control purposes. Typically, the animal will need to be confined by its owner for 10 days and observed for any sign of rabies. If you are bitten by a feral dog, cat, or wild animal, call animal control so that the animal may be observed for illness. As a home health aide, you will come across patients who rely on oxygen in the home. Although oxygen is a safe, non-flammable gas, it does play a role in combustion. This means that things burn easier and ignite faster in the presence of oxygen. People should never smoke while using oxygen. People on oxygen must stay away from heat sources such as open flames and sparks. Do not use petroleum-based products in the nose or on the face, such as Vaseline. Store oxygen canisters upright and in a secure spot. When not using, make sure the oxygen tanks are turned off to avoid flooding the air with oxygen.